Hola y bienvenidos a Tu Salud, the definitive podcast for Latine and Indigenous health policy, where we talk about all things Latine, policy, and our health. I am Dr. Seciah Aquino, Executive Director at the Latino Coalition for a Healthy California. And today, I am joined by the amazing Crispin Delgado, Executive Director at Insure the Uninsured Project. Today, we'll be talking about the power of community wisdom, health as a sound economic solution, and the magic of Vaporu. So let's get started. Well, muy buenos dias, Crispin. Thank you so much for joining us today.
Thank you, Seciah, for having me.
Of
It's
course.
such a pleasure to be here.
Oh, we're so excited to have you. Well, to get us started today, do you want to just share a little bit about yourself, your story, what makes you you?
Yeah, absolutely. So I am the son and grandson of Mexican immigrants. And for me, I was born and raised in Richmond, California, which is a low-income community in Northern California. My grandparents and my parents really inspired me in terms of coming to this country with very little, but working hard to, realize a dream that they had. Trabajadores, yeah. My grandfather started off in the Bracero program. So he was out in Wisconsin and was exploited the first time he worked for 3 months and walked away with nothing. He ended up coming to California to work on a cherry farm, and he became friends with the supervisor who then offered him residency. He said, if you work for 6 months, we'll give you residency. And so he did that. And then he said, if I do it for another year, will you let me bring my 2 oldest sons? And he did. And so that's eventually how my dad came as a teenager to California. And, over the years, I've just seen my parents and my grandparents as givers. So when you ask me, why did I work in philanthropy? What was my first experience with philanthropy? It was my parents that would give people food if that's what they needed. They would also provide shelter. They had a saying that said, de la puerta al rincón, todos colchón. Yeah. So meaning, we have very little, but we'll share it with you. Yes. And so that for me, really influenced how I approached things, how I saw things.
I love that.
And, growing up in Richmond was tough. Like I said, it was at that point rated one of the most violent places in California and in the nation. Yeah. When I was 13, my brother was 16, and he was crossing the street during lunchtime, and he was a victim of a random act of violence at the school. And so 3 people got shot. My brother, unfortunately, was shot in the head, and he died a couple of days later. It's hard when people say, oh, everything happens for a reason. But, out of this, I think is what opened the door for me to go to college, to become the first one to go to college in the United States. It was difficult. And I think that we still have remnants of that, right? That thirst, that hunger for justice that we didn't get. And so when I left Richmond, I went to Davis as an undergraduate. And again, looking at my culture, reflecting on my culture, and just how different it was to go, from a city where police sirens were your lullabies at night to a place that was just so quiet. It actually made me more paranoid than feeling safe. But yeah, that experience of just working hard and trying to be an example for my nephews and nieces. And ultimately, now, years later, I got a fellowship to graduate school. So I did my master's in public policy at Berkeley because of that fellowship. Now, all 7 out of my 7 nieces and nephews are graduating college. The last 2 graduate next week.
Congratulations.
Thank you.
That's so exciting.
Yeah. So more than anything, that's my story, that I decided to focus a career in public policy, specifically on public health, because I wanted to help families like mine, people that looked like us.
Right.
and recognizing, the specific issues our community has gone through, including having to translate for our parents, having those awkward conversations. And I think that there's been improvements, but there's definitely more way to go.
Yes, we have a lot more to do.
Yeah, I think we all do.
Yeah.
And
go ahead.
No, go.
I think a couple of things that you shared really resonated with me. One, the way that our families share with one another, right? I similarly grew up where we were struggling to put food on the table, but there was always enough to share with the neighbors. If we were having a carne asada, everyone got a little piece of meat and a tortillita, right? There was always enough to share.
Absolutely.
Yeah.
Frijolitos, sopita, like all of it, right? And I think that was also my parents' way of welcoming people into this country, which, when my dad first got to California, he would go out to different places and they would say, no blacks, no Mexicans, no dogs. Wow. And, he experienced that firsthand. Right. I feel like my grandfather was a little bit more isolated from that aspect, but my dad was trying to go to high school. My dad was trying to work, and so he experienced that firsthand.
My goodness. And that structural racism, outright racism, right? It's unfortunately still amongst us. And we hear it in the rhetoric, right? This is an election year, and a lot of that narrative is still around, unfortunately.
Yeah, I feel like with the former administration, there was almost a social permission to really express yourself in a way that I didn't see firsthand growing up. The way I experienced it during the pandemic, during the last presidency, of just people being really angry, people explicitly being racist and discriminatory. And so, I think that there's a lot of work to do in that area as well. It's just even acknowledging racism exists, and our systems are based on racist perspectives. So how do we make it better?
Exactly. And I feel like through academia, right, we've been through certain seasons of calling it, in a different term, implicit bias.
Yeah.
And ultimately, we just have to call it for what it is and the way that we experience it. And quiera que no, it is a trauma that we grew up with.
Absolutely.
And like you mentioned, right, witnessing violence in our communities. I still remember one day waking up to a full SWAT team outside our one-bedroom apartment and thinking that was, normal. And the police sirens at night being our lullaby. That is wild that we had to experience that, and not everybody does.
Not everybody does. I for sure thought that it was normal.
Yeah.
And it wasn't until I left my community that I recognized, like, oh, like my environment was way different than this. And I also, compared to everyone else in my community, I didn't feel poor. And it was like the context of, no, bro, you're actually poor when you like go into a different setting. I had a car that I purchased, a little Honda Civic, that the way I paid for it was working in high school, but also settlement checks that I got from every time Chevron kept having explosions, and we were having health problems because of it.
Right.
But that little car got me everywhere. Yeah.
I love that. Yeah, I think, it's so interesting that both of our current roles, and our life missions are focused on addressing those social determinants of health, advancing health equity. And part of that is addressing the socioeconomic structures that we live within, right? And that's why addressing the socioeconomic well-being makes such a big difference. And it's not just about healthcare access, right? We need to make sure that as a whole, our communities are well, they have the opportunity to continue their studies or, continue advancing in their careers so that we can continue to break those poverty cycles.
Exactly. Fortunately, my parents were able to buy the house I grew up in the year I was born in 1978. And, that made such a difference in terms of actually being able to have equity, having a home. And this was all at the time where Richmond was changing. So it was a big port during World War II. And that's where Kaiser shipyards were stationed. And that's where Rosie the Riveter, like we can do it, was based in Richmond. And I always thought that Rosie the Riveter was white, but it was actually a term coined for multicultural women. And I think that that's important to know, especially for kids of color. Like there's actually, icons from this area that did wonderful work on behalf of this country, but we never celebrate that. We never owned it. And so, my parents' ability to buy a house in 1978, they had just missed Prop 13, which would have protected their tax rate for forever. But I also recognize the research shows that up until 1978, 98% of home loans only went to white families. So that tells you, as people, especially white populations, were the grand exodus out of Richmond to suburbia, they took along resources with them. And what is now called redlining, really impacted what kind of money we had for our education system, our public education. And, I lived there, so I know what it's like to be in a classroom with leaky roofs and having very little access for nutritious food.
Ripped textbooks,
written in textbooks. And yet you're expected to compete with people that have gone to private school or have had tutors their entire lives.
Exactly.
Yeah.
Yeah. And a theme that has come up in a couple of our other podcasts has been this desire and this connection with the community to do better for our parents, to help one another, right? And because we were growing up in these diverse communities, it was almost easier to unite in the fact that we were living in these conditions and to have this desire to change things and to, for many of us, be the first in our family to go to college or, to open up doors, not just for our individual families, but for our friends, our communities. And it's that desire. And what I keep hearing from our amazing guests is that passion, that desire, that commitment to keep the doors open to make sure that more of our community members were coming with us.
Exactly. I think that that's a big lesson learned as a young Latino American child, which is the Latino families, for the most part, are all about community. It's about us as a group. How do we survive as a family? How do we thrive as a family? And not like the American individualism where it's pick yourself up by the bootstraps.
Right.
On the day that I actually graduated Davis, I did the Latino graduation, and I was allowed to bring up a couple people with me. So my grandpa, who was the first to come to the United States, and my dad and my mom joined me up there because, I wanted to recognize that I didn't do it by myself.
Right.
Without my family, I wouldn't even be in this country if it were not for my grandfather taking that risk.
Right.
And so, when it came time to celebrate, I was like, this is an achievement for all of us, right? And recognizing that as well, because, in this country, it's all about, the mentality is pick yourself up from the bootstraps, but you also, when you grow up in a certain way, you want to give back. You want to make sure that you have that ability to share what you're learning, to create networks for other young, brown, Black kids that just won't have a network, a professional network.
Exactly. And I really wish, my dream is that, all of us would be able to really engage with that belief and that value, because I do think the pull yourself up by your bootstraps, very American mentality, right? limits, unfortunately, the work of public health, because that's what we preach in public health, right?
Yeah.
If we are bringing up one community, we're also bringing up other communities. It's not individualistic at all. It's population health.
Exactly. And, with equity too, it reminds us some people don't have shoes. So there's no laces to pull up.
Exactly.
And so I think that's another thing with our leadership and really trying to look at equity of, how do we make sure people need what are provided with what they need.
Yeah, 100%. I love that. So tell me, how does this passion, so you grew up in this amazing neighborhood, seeing the realities of life as a child.
Yeah.
How does that push you into that next season of your life? Davis, what takes you beyond that into your career today?
Yeah. No, thank you for that. Like I mentioned, as an undergraduate, I was working 3 jobs. I double majored. I studied abroad. And I finished with honors and the highest honors. And it was an opportunity for me to reconnect with my culture. So I was a mariachi singer in college. Yeah. And then I also studied abroad and lived with my uncle in Monterrey at the best business school in Latin America. And so, those opportunities were sort of part of my evolution. One of the thesis that I did for my Spanish major was around identity. And specifically, I applied Engel's dialectical theory to identity, which is not everything is constant, but it's constantly changing. And so I said, the first formative years of my life, I was a displaced Mexican kid because my parents, the only culture I was receiving were my mom and dad.
Right.
Some Sesame Street. But by the time I got into elementary school, that's when I started to feel the pressure of, are you Mexican? Because I'm at home, you're Mexican and can only speak Spanish. But then you come into American life and it's starting to balance the tensions of, why don't we eat pizza? Right? Like, why is it always frijoles and tortillas? And so, to me, the political awakening happened when I went to Davis. And part of that was the social context of what was happening. So Prop 187 had just gone through. And so Pete Wilson was the governor at that time. And it really set a tone for, for immigrants not to take too much, to create a fear of accessing care, of accessing any services, including education. And so, and at the same time, when I got to Davis, they were eliminating affirmative action. And so you see these big systemic changes that are happening. And for me, with that political awakening, it felt like the right thing to do, to say, how do we fight back? And for me, I realized that through a fellowship with called Public Policy and International Affairs, PPIA, that I could actually pursue a even higher education and really dedicate my life and my career to helping families like mine. And once I saw that opportunity, I tried different things. I started off in academia, fell to ivory tower. I went to work in local government, and that's where I really cut my teeth and really saw what it meant for individual people and families and seeing them as people, not numbers. And then philanthropy gave me a gift of being able to honor my parents, philanthropic activities that they did as a kid, to now invest in the communities, in the organizations like LCHC, that are making a difference, that are the voice for the voiceless. And now where I find myself at Insure the Uninsured Project, I recognize we have made huge advancements in coverage for people. So what's next? Now that people have a card, can they access care? And can they access care in the right place, whether it's in a clinical office or at your dinner table? And is it in the right language? Do you still need your kids to translate for you, or are there systems in place that account for that? And so I think that my career has led me here because it's just been a constant theme for me, which is um, access to and quality of
Mm-hmm.
care for low income and communities of color,
Mm-hmm.
especially Latinos.
Yes, 100%.
Yeah.
I love that you say that. And something that comes to mind is, in anthropology,
Yeah.
you know, one places themselves in the situation to really experience the culture, and then you come out with some sort of thesis or learning from that experience, right?
Yeah.
I almost see our lives with that
Yeah.
anthropological lens, right?
Yeah.
We've been placed in these situations to deeply and truly understand what our communities go through on a day-to-day basis, which for many people it's a blind spot because they've never been through those situations. And it's like you said, it's hard situations, but it's also a privilege to have that insight because now we know the things that need to change.
Absolutely. And, you know, I agree with you. I
Yeah.
feel privileged that I learned the language. So that was the beginning, right?
Yeah.
Just even learning the concepts of speaking truth to power, to understand where decisions are made,
Mm-hmm.
and then having the ability, and not only that, the responsibility
Mm-hmm.
of representing those that cannot
Yeah.
access those places and those rooms.
Yeah.
And yeah, that's what I see as the biggest gift of an education is, being able to advocate for those that can't advocate for themselves, and also trying to, disrupt those
Yeah.
systems that were created intentionally with a racial bias.
Yeah. To leave us out.
Yeah, they were not,
Yeah.
they were never meant for us.
Mm-hmm.
And now we're trying to retrofit
Mm-hmm.
equity
And
into
that's why
that.
it's so hard.
It exactly that
Yeah.
it requires social change at a different
Exactly.
level. And for us, the last few years, especially after the pandemic, where I called it out like
Mm-hmm.
the first week, I said this is going to amplify health and wealth disparities,
Yep.
because the people that are going to get hit first, hardest, and will take the longest to recover are people of color. And that's because of the structural factors and dynamics that
Mm-hmm.
have been put in place for
Oh yeah.
centuries.
Oh yeah.
And it's amazing to me that we have stopped talking about COVID,
Yes.
because there's still a lot of people that are suffering. At a speaking event that I did recently, I talked about, just having an empty chair at the dinner table, and like how does that impact your mental health?
Yeah.
And grieving abuelita, or
Mm-hmm.
and it's really difficult to
Yeah.
get culturally competent mental health services and
Oh yeah.
therapy and things that people need, adults and children.
Yeah, I couldn't agree more. And our community is still facing acute cases of COVID-19, long COVID, the socioeconomic repercussions of that recovery, right?
Yeah.
For those of us that had the privilege of having a job that carried us through the pandemic, we were able to bounce back and.
Yeah.
But for many of our families, like you said, maybe the breadwinner is no longer there to bring money and food to the table, and families had to reconfigure and find some other way, right? And our families are still struggling with that.
Yeah, absolutely. And right before the pandemic, I had gone through when I turned 40, I went to the doctor, and I had been having headaches. I thought they were migraines. And I was surprised when they told me I had a tumor the size of a golf ball.
Oh my goodness.
And so that kicked off, brain surgeries, radiation, chemotherapy. But, I recognize, even after all of that I'm lucky. I'm lucky because I knew the system. I'm lucky because I spoke the language. I'm lucky because I caught it at a point. I mean, it was large, but, they were able to help me. By contrast, a woman who would come and help me clean my house, who's a good friend, was diagnosed with breast cancer, right? And this is after her husband was in a car accident with her. He was her ride to her job, so she got laid off. And it was just compounding. And I know that people say when it rains, it pours, but I look at my experience compared to her experience, and it's so different. And you wish that our systems could do better, that they could meet people where they're actually at, whether, supporting them with transportation, in addition to the service, childcare. How many, you can't take your kids into chemo, which can be hours. And so, having that personal lived experience of navigating systems, throughout California, but also in Washington, it's like I'm lucky, but it also made me open my eyes to so many people that engage in our healthcare system that are not lucky.
Yeah. First of all, thank you so much for sharing. I appreciate you sharing your story, and we're the lucky ones to have you here. Honestly, thank you.
Oh, thank you, Seciah.
Yeah.
And going back to like health equity and advancing it, I can't do it alone. You can't do it alone. Like, we have to work together.
We do.
Right? And making sure that the resources that we have and the platforms that we have, we're having the right conversations with the right people and bringing our gente along.
Yeah. I love that. I think there's so much power in our lived experience, in our community. It's almost transforming and flipping the system on its head, right?
Yeah.
These formal positions of power who were not at all connected with the systems that were created for the people that were intended to serve, were making decisions blindly. And so we need to reshift those power imbalances to put our gente at the center, to make decisions, to speak about their priorities and their needs, so that then we can make policy decisions that will be sustained beyond both of our lifetimes, right?
Absolutely. Absolutely. And, I just want to recognize too that we do have power, right? As especially the generations that have either naturalized and became citizens, or all the young Latinos that were born here. I think sometimes we waste our opportunity to vote, which is our voice. And, I would just really encourage young people, older people to engage in the civic process. We have a really, really important presidential election coming up. And I hope that, people will do their research and go out and exercise their voice, because we need it. We can't do it alone.
100%. And I think that's another system, right? Just with civic engagement, our communities have been left behind, have been many times structurally been left out on purpose, right? Because we are so powerful, and people are fearful of that power that we can leverage.
Absolutely. Absolutely. And, a shout out to my mom, who actually, after she came to the United States, when, she in Mexico, she only was able to go to the 6th grade. But here she signed up for community college, learned English, took the citizenship test, passed it. So she was the first like American in the family besides us that were naturally born here. But I got to experience democracy through her eyes, because I still had to translate for her.
Right.
And like you said, there's some structural barriers that just happen with wanting to participate in our democratic system. For example, propositions where yes means no and no means yes, and
they're meant to be confusing.
They're meant to exclude people.
Yeah.
And so, I think that that's definitely an area that I would encourage people to try to, connect with other people in the community and help each other, read through those things, or find resources that can help you navigate and process what they all mean.
Yeah, 100%. I think about too, our documented and undocumented Americans who may not have the privilege to vote, but like you said, they can support others in understanding the material. They can move families, right, to practice their privilege to vote and to, cast their voice for a huge decision that impacts all of us.
Absolutely. Absolutely. And, you don't have to be an immigrant yourself to have empathy for the situation that they're going through.
Yes.
And just recognizing that the issues that impact them impact all of us.
Yes.
And they are such a critical part of our economy. But beyond that, they're people. And we need to do the best that we can do for people, because during the pandemic, they were the first ones called essential workers, but have never been treated essential.
Oh, no.
Ever.
Yeah.
So, I am hoping that there could be a social shift in recognize and rewarding them, whether that be with a pathway to citizenship or even allowing them to work freely and engage in the tax system. I know that many of them pay more in taxes than they receive in benefits. And so, it'll just be so rewarding for all of us if we can continue to diversify and embrace people with new ideas that come into this country.
I completely agree. And many times we pay more taxes than certain people that we will not name here today.
Absolutely. That's real.
Yeah. I love that you brought the economy into the conversation. I think many times for us who are passionate about health equity, it is that moral and ethical commitment to doing the right thing. But in many times, and this in advocacy, the bottom line is always, well, how much does it cost? Do we have enough money to do this? And it's a fair question. But the theory of human capital tells us if we keep our communities healthy, we also keep the economy healthy. So it's a sound economic decision to invest in public health solutions.
Exactly. And, Ceci, I believe that you either pay for it in the front end, meaning, people going to the emergency room, even though it's not necessary, or you could pay for it on the back end.
Yeah.
And by giving people access to coverage that is preventative, you're going to save a lot more money in our systems than if we just wait for people to come in sick.
Yes.
And I think that it also goes towards like an ROI or, the return on investment, and really thinking about this is the smartest way to spend our money and to prioritize preventative care and to get people like my friend that went through cancer, detecting early, because it's part of the regular access to care that's necessary. So yeah,
I couldn't agree more. And I think that leads us perfectly onto the $1 million question.
Yeah, please.
How do we achieve health equity for our communities?
Yeah, that's a great question. I think, it's a complex question that is not just going to have one simple answer. I think, starting with healthcare in and of itself, right? So do people that enter our system, are they met with people that look like them? Right? And because that not only brings in cultural aspects, it creates trust. I think that creating systems or reinforcing systems of care that are built on trust, that are built on people from the community that actually work in the facility, all those things help improve health equity. I think nowadays there's also a push for community health workers and promotoras, which I see as a bridge between community and our healthcare systems. Because even it doesn't matter if you have a master's or a PhD, they're difficult systems. They're broken. They're fragmented. And so, having people that are just dedicated to helping people navigate the system is so important. I will also say with equity, something that I mentioned earlier around access to technology, to be able to have options. At the end of the day, I think that that's what everyone wants, is a decision point, an option for what is best for me. And, I will say people will always bring up the digital disparities that exist, and I agree with that. But I will also say at the same time that a lot of lower income people actually are more likely to have a cell phone and a smartphone than they are a landline. Most people nowadays don't even know what a landline is. And so as such, we have to rethink about incentives. So I know when I worked at a county and we talked about young mothers and engaging them in their in the prenatal care aspect of their healthcare, we knew that they were using smartphones with minutes. And so the incentives then became, let's give them more minutes and they're more likely to come. And so, embracing those kinds of strategies, I think are so important to making sure that we have a more equitable system.
I love that.
And lastly, I'll just say, going back to what we talked about earlier with behavior, access to behavioral health, it's important that our systems work for people, not for profit. So that if means if you're in the office and you're doing your physical exam and you share that you have been feeling blue in the last 30 days or unwell or sad, that they're able to do a warm handoff to a therapist right then and there who will then schedule something with you. Until now, we're starting to now see that sort of transition and warm handoff, but our systems were not built that way. Our payment systems were not built that way. Our professional placements have not been built that way. So, it's up to organizations like us that are advocates for the community to raise these as important components of our health system that we need to improve.
Thank you. I couldn't agree more. And I think the solutions that you highlighted are in culture solutions, right?
Yeah.
They come from the wisdom of our communities, from the natural social networks and trust networks that we have with the promotoras, with the schools, where our gente is and where our gente moves.
Exactly. And promotoras, it's not a new concept. It might be a new concept here, but my mom always had those comadres she could call, and they knew exactly where to go, how much it was going to cost you.
Where the health fairs are going to be.
Exactly. But the comadres and, having some canela talking about, you should really take your kids here or sign up for this and that. That's essential. And, when you rely on a relationship like that is already based on trust, they will listen to you much more than a commercial or, an ad on the radio. Because we need more people like that. And for them to see themselves as part of a team that is providing that primary care.
Exactly.
Because when you tell people eat healthier, but they don't have a single grocery store in their community, what is the purpose?
I couldn't agree more. And investing in those solutions, right? I think many times our community members just get taken for granted. Oh, of course they'll pass on the word because that's what we do. But also being, responsive to the fact that those promotoras have families that they need to support. And many times they're paid with a gift card, and the gift card doesn't pay the bills, right? So making sure that we're embedding them into our systems as staff, as career trajectories that they can continue to grow and evolve and continue to increase their salaries.
Absolutely. It should be professionalized in a way that also accounts for all the lived experience that many, I've met a lot of promotoras that are immigrants themselves. And I wouldn't want to exclude them because they didn't have the opportunity to go to a 4-year university.
Right.
And so, creating those pathways for them to be empowered, for them to also benefit, because they're saving the system a boatload of money. So how do we share some of those profits with the people that deserve it?
Exactly.
But I do see some positive changes in policy that are supporting that, with CalAIM, for example, now looking at community health workers and promotoras. But I think that there are so many elements to achieving health equity. Another point that I just like to call out is data and accessing data and looking at disaggregated data so that we know exactly where the disparities are. And then we could work towards closing them.
Exactly.
And, up until now, we just haven't had that data. When I started off my career, I used to enter rooms that were just paper files. And if you wanted to do any sort of analysis, you would pool files and analyze that way. Now we have electronic health records. And I would say we're probably using one finger worth of all the data that we could mine. At a recent event I just went to, they said that on average, one electronic health record per patient is getting 10,000 bytes of data a day. So now you multiply that by the tens of thousands, if not hundreds of thousands of patients. There's so much data that, that's where I also feel like artificial intelligence could have a role in how we process that data and think about reaching at-risk populations and having an intervention with them to avoid heart attacks, to avoid strokes, to avoid, cancer. There's so many different ways to do that.
Yeah. And data, has been, again, it's another system that tells a story, right? And for Latine and indigenous communities, we're so diverse. We're not a monolith. And many times we get lumped into, Latinos. It's a big bucket, 40% of the population in California. But when we dig deeper down into those intersectional identities, our indigenous communities, and we're not seeing the disparities because we're not many times even collecting the data at that detailed level that we need.
Absolutely. And, we each have different cultural practices. I will shout out to my mom again with Vapuru, which, could even cure a broken leg. But
it's magical.
It is magical. We should buy stock in it for our community. But, what is also real is like when you injure your arm, you go to masajero, right? And
curandero.
A curandero as well in other parts of Latin America. And it's just important to embrace those. I know that now, for example, acupuncture is one of the benefits that is rolling out with CalAIM. And, what is the possibility to also bring in some of the practices that our parents, our grandparents, our ancestors used?
Yes, I love that. Embracing our power, embracing our culture, and moving forward with that mindset.
Exactly. Learning from our history and building for a better future for all of us.
That's amazing. I think that's a beautiful way to capture our time together today. A Tu Salud.
Gracias.
A Tu Salud. It was so good to have you here.
Thank you so much for having me,
Seciah. That's so amazing.
Yes. Thank you.
Gracias.
A ti.